Hi, this is Jessica DaMassa, and I'm here at Health Datapalooza with Dr. Rasu Shrestha. Rasu, welcome. It's good to talk to you. I understand you're the co-chair for this year's program.
I am. It's such a pleasure to be able to work with such a fantastic team at the back and really push the program forward. Really excited. Thank you.
We're going to come back to that in a second, but before we do, I want to talk about UPMC. So what is going on there?
So UPMC is continuing to move forward. We're this large integrated payer-provider system that has a knack for innovation and entrepreneurship. We're really double downing on our mandate to reinvent the future of healthcare and leading that charge with the front of innovation and entrepreneurship.
Tell me about some of the specific things you're doing, because I know this is something that is actually directly one of your responsibilities as CIO. So what are some of the things you have going on?
Yeah, so I'm charged with innovation for UPMC, and I'm also the EVP for UPMC Enterprises, which is our innovation and entrepreneurship front end. And I work with a team of brilliant individuals, and what we're doing right now is we're really focusing on a newer area, something that, a muscle that we've not really built before. And this is around translational science.
Okay.
Right, so we just committed to a massive level of investment in translational science, and it really goes to the roots of who UPMC is all about, really. So there's this history in Pittsburgh of solid organ transplantation, right?
Okay.
The Starzl Institute, Dr. Tom Starzl, he created the science and the medicine, basically, of everything that defines liver surgery.
Okay.
And some of the greatest advancements that have been made in solid organ transplantation really have been perfected at the Starzl Institute. So that's the history. And we're like, what's the future? Okay. And the future, we believe, is really where we say, all right, part of the reason patients suffer from solid organ transplantation is organ rejection, right? What if we're able to really go after the immune system and handle it in such a way that we were able to, look at the T cells, the B cells, the CAR T cells, and address the immunocompromising that happens around these patients, and so there's been so much research that's been happening in Pittsburgh around this, and so much opportunity for entrepreneurship in that realm, that we said, that's our next frontier, we're going for it, and we're pushing the frontiers of not just immunotransplant therapy in terms of transplantation and moving it to the next level, but also immunotherapy as it relates to aging.
Okay.
Immunotherapy as it relates to the cancer moonshot and solving for and finding the cure for cancer. So a couple of different fronts in that translational science newer initiative that we're really pushing forward.
That's so amazing, and it's so grounded in that medical history and surgical history that you have there at UPMC. I mean, that's truly revolutionary. So what kinds of things are you starting out working on right now? Is your initiative just unfolding, or where are you at in the process?
So we've been behind the scenes working on this for a while. We just recently announced this, and what's happening right now really is for some of our top clinicians and researchers that are really passionate about this, coming together with the right business counterparts and entrepreneurial counterparts that we're pulling together at UPMC Enterprises. So what's happening right now is really in the formation stages, right? So all of the right components coming together, and that's essentially what we do at UPMC Enterprises. Is when we have found and identified an unmet clinical or an operational need, we put a force field around it. We say, all right, hey, look, here's a safe space for you to maybe create these innovations. We have a fail-fast methodology, and scaling success then becomes easier when you're identifying this and providing the force field that it requires, but also the level of funding and entrepreneurial zeal and enthusiasm that we know that is needed, and sort of the organized approach that it takes for these fantastic, research work and academic work to really see the light of day on the entrepreneurial side, and for these to be successful companies that would not just make a difference in the living lab, that's UPMC,
right,
but in the marketplace, so we can take it out there and share the joys of the outcomes that we're experiencing with the rest of the marketplace.
Okay, so I want to switch gears a little bit here too, and I want to hear about your new role working with the government. So tell me a little bit, what exactly are you doing? What have you been appointed to? What have you volunteered for? Tell us what's going on.
Yeah, so it's really an honor, right? Where they've reached out to me, and this is with the VA, where there is this thing called the Open API Initiative. And this is really around interoperability and pushing the boundaries of interoperability forward. And at UPMC, in the last decade of interoperability, I've been fortunate to be part of the team that really was pushing for us to have interoperability as a framework for all of the different systems that we have across UPMC. So we're both Cerner and Epic. Okay. Cerner, no, and it's the best of breed.
That's a reality. That's a reality
it's a
for
reality.
a lot of systems.
It's a reality for UPMC that we bought into purposefully, right? Because what we wanted was to have the ability to really give clinicians the choice. Right? And way back when we decided to go with both of these systems, Cerner was really good as an inpatient system. And Epic was really good as an ambulatory system. And now, they've all sort of improved their systems on both sides.
Sure.
But we invested in interoperability as a strategic framework, right? As an imperative way back when. And it's now given us an unfair advantage of sorts in the industry because we've essentially, managed to tackle a lot of the challenges in terms of data exchange between the systems, in terms of syntactic and semantic data harmonization, in terms of looking at the realities of data exchange across the health information exchange, right? So the VA happens to be actually quite like UPMC in terms of it also being a payer-provider system, an integrated delivery financial system, much like we are, except it's much bigger, obviously. Right. And when the VA started looking at the EHR modernization track that they're on right now, I guess they must have seen some of the work that we'd been doing at UPMC, and so they reached out to me. So I'm specifically helping out with the Open API Pledge.
Okay. And tell me what that is. What are people pledging? Who has pledged?
Yeah, so it's really interesting. This was announced on the heels of HIMSS recently. And the pledge really is for provider organizations initially to come around the table and say, all right, look, this is important for the VA, for our veterans and their families, for us to be able to come around and be able to share data, to be able to have these open APIs enabled at the back end. So when we talk about interoperability and opening up systems, we can be more specific around the language. And that's really what I'm trying to do, is to bring together this coalition of the willing, right? So these are, my peers across the industry.
Sure.
So we've got, the initial dozen pledgees are large academic medical centers like Intermountain and Cleveland Clinic and Hopkins and Mayo. And all of them have come around and signed this pledge. And they're really motivated to say, hey, look, this is the time. This is the one opportunity that we have as the VA is looking at potentially, the biggest EMR contract ever doled out in the history of the United States. And I don't think something like that will ever be doled out. Now, look, a lot of things are still up in the air in terms of decisions and whatnot. But regardless of where things are, if you look at the opportunity at hand, it's tremendous.
Right.
And what's interesting is from the time that the announcement initially went out to today, we've gone from the 12 initial pledgees to about 170 that have pledged. And it's just amazing. So a lot of opportunities. I'm really excited about this. And this is great from a UPMC perspective because we've always believed in this. This is essentially what we've been pushing for.
Kind of forced to be believing in it.
Exactly. And for the industry as a whole, this is the one opportunity I think we have to really step things up and get it right.
Tell me, jumping off of that, okay, so this is the one opportunity we have to really get it right. And so what do you hope happens? Like, what do you need to see happen in the next year or so in order to really feel like this has made the difference in terms of getting people to just, be open with their data and really take advantage of the opportunities that affords?
So that's a great question, right? So what is it that we're trying to push for, right? So what it is for us to really put a collective ask together. Enough with the vagueness of, hey, open that system up. Hey, you guys, and I'm talking to the EMR vendors as I'm looking, you're not open enough, right? What we need are specifics. And the EMR vendors actually listen to customers, right? But the customers don't have the language They don't know the language. They're like, yeah, all right, so I need this.
Sure,
So,
they just know what to ask for.
right, so what we need to do is really put this collective ask together and say, look, it's not just, a trickle-down approach around opening specific attributes around HL7 Fire. It's really looking at not just the 6, 7, 10 attributes, but, here are the rest of the attributes that we actually need, and back that up with specific use cases
Sure.
that are demonstratable, and put that collective ask together and say, hey, look, these Fire resources shouldn't just be read-only. Maybe they should be, a two-way write-back capabilities as well. So be really specific around the ask, and if collectively, the coalition of the willing can put this together, there's a chance that the vendors would actually listen. And initially, as we've been talking to each of the large vendors, they're nodding their heads and saying, yeah,
Let's do it.
we'll do it.
Coalition of the willing grows.
Exactly. Because if the customers are asking for it and there's good rationale behind it, this is more of an organized approach to get things done. And if we can do it for the VA, then we can, essentially model this for the rest of the United States. I mean, seriously, right? Because the VA is the largest health system in the country. So that's the hope, that's the goal that we have. And what we're doing is we're not replicating, efforts that are already underway, like the Argonaut project, for example. What we're doing is we're working hand in hand with, leaders from the Argonaut project and various other interoperability efforts across the industry and saying, all right, we're providing focus. Right, with this as the leading front, with the coalition of the willing, let's provide the level of focus that we need to, set things on fire. Pun intended.
Oh my God, I can't believe you just did that. I should give you this mic and let you drop it. So I have a question. So if people want to get involved in this, or they want to show their support, or they want to sign the pledge or whatever, how do they do that? Is there a hashtag coalition of the willing that you've set up now on Twitter, or what are you doing?
That's not a bad idea.
Coalition of the willing, you heard it here first.
Right, so va.gov, if they search for OpenAPI or just Google OpenAPI in VA, they'll find it. But yes, so click the I pledge button. It's really easy.
Cool.
And what we're doing is we're gathering people, like-minded people. That's all it's ever taken in the history of mankind,
Small group of like-minded people.
Small group of like-minded people with a shared sense of urgency, right, and values, to come together and say, all right, let's make change happen.
Definitely. All right, hashtag coalition of the willing. Dr. Shrestha, it's such a pleasure to speak with you always. Thank you so much for your time and for everything here at Health Datapalooza.
Thank you.
Thank you. This is Jessica DaMassa.